We all get to work in different modes of transportation, from a car to a train to a bus, but what about a plane?
That's exactly how some specialized doctors from Southwestern Eye Center get to some of their more remote offices across the state. Ty Brennan tagged along on a recent trip to Chandler, and he has the story tonight.
When you think of private planes, you usually think of celebrities and how the rich and famous get around. But for Dr. Anthony Debuse, a retinal specialist at Southwestern Eye Center, this is just his ride to work.
So this is kind of your daily routine. You come to an airport and you fly off to different locations every day, right?
That's correct. About 3 or 4 times a week we travel on the road to remote locations in Arizona.
Today, Dr. Debuse and his team are heading to Yuma for a long day of seeing patients.
And how long ago was that injection?
And performing surgeries. Southwestern Eye Center has 24 offices. The planes allow the specialists to see hundreds of patients a week.
Usually 90% of the recoveries in the first 6 months.
At some of their more remote locations across the state.
We're spread out enough that driving just isn't practical. It takes 4 hours to drive out the Yuma and back. That's the whole day, 8 hours. So flying makes a certain amount of sense.
At any given moment, there's a plane in the air somewhere with some of our doctors on it, it seems like.
Shane Armstrong is the Chief Operating Officer for Southwestern Eye Center.
It just created an opportunity for patients to get really exceptionally good care in their own communities without having to make the travel and endure the expense.
The daily flights, not cheap. Southwestern Eye Center shells out a significant amount of money every year to fly their doctors out, but it's something the company has been doing since the 80s.
Early on, Dr. Bluth, our founder, just said, well, you know what, why don't I go out and see them? They had the office out there at Falcon Field, planes were close by, and so they started traveling out, seeing patients.
Dr. Debuse, I'm the retina specialist.
Back at the center, Dr. Debuse begins seeing patients.
Good. Hi. Nice to see you again there, sir. It's getting worse in that left eye, yes? Yeah, let me take a look and see. Look straight ahead for me. And a little bit of lid droop, pretty profound ischemia, pigment clumping, and a few drusen. The disc is about a 0.1.
Suzanne Reckling from Yuma is a longtime patient. She appreciates having the doctors come right to her without having to worry about traveling to the valley.
I live alone, and I have to have friends or someone. If I'm having surgery, they have to bring me in and take me home.
After 40 patients and 5 intricate surgeries, Dr. Debuse is on his way back to the valley.
This is my routine.
All in a day's work.
Jump on the plane and go to work.
In Yuma, Ty Brennan, Fox 10.